everyone, my name is Hannah Owen, and this is my presentation on why I think healthcare professionals should renew their license. In the state of Tennessee, healthcare professionals are required to renew their license every 2 years. They are required to have up to 40 continuing education hours, and in the United States, every state has some type of requirement for license renewals. Continuing education hours are very important, and every state has those as well. The reason I bring this up is because not all countries require their healthcare providers to renew their license, and that could be dangerous because the healthcare industry advances every day. License renewals are proof of competence, and it improves upon experience already gained by the job. First will be advancements in medicine. Vaccines advance all the time. The CDC comes out with a new chart of vaccines for kids every year, and some of the considerations would be the safety and efficiency of the vaccine for the children, the amount of people with the disease if there is no vaccine, and how likely it is that other people will get the disease. Technology would be the next step, and this one actually kind of blows my mind every day because AI and VR and AR are wild, and they actually improve upon everything we do, but in the medical field, they are helping a lot. 3D printing and robotics help with surgeries as well as just anything that we do in the hospital. They can make splints. It's super cool. Medications are super important. 53 new drugs are added to the market every year, but over 1,000 are taken off every year. So if you are a provider who doesn't get their license renewed, then you're not really up to date on the new drugs. And I know that some providers, they do use an app to tell them like the new information about the drugs, but if you're not keeping up with that, it could get dangerous for the patient. Proof of competency. So the legal reasons is you have to have a license to practice. It's just part of our government. People don't like people working on them with no license. Trust of the patient is super important. If you are not trustworthy, then your patient will not come back to you and their treatment could get messed up. Trust is big for the whole team. Healthcare providers work as a team, and their patient is basically their captain. So if their captain can't trust their crew, then nothing's going to get done correctly. And experience is super important. Experience can be valued in some ways. However, no matter how much experience you have, everything that's coming up and being brought in and new and different can be scary or overwhelming, if that makes sense. Everyone needs a refresher from school. I know for me, I lose like half brain cells every time I leave the school building. But every 3 years, you lose about 65% of the knowledge that you had. And then employers usually appreciate up-to-date license. I don't know if you've ever had to get a job without a license, like that doesn't work like that. And then in my conclusion, I understand that some healthcare professionals may say, well, I've done the same job for 20 years. I don't really need to learn anymore. Like I'm not changing jobs, I'm not doing anything different. I get that. However, the new people coming in to the job are trained differently, they know different things, and if you aren't all working on the same page, then you're not going to get the things done that you need to get done. So thank you guys for listening. This is my Works Cited page. I appreciate it.